Have your chance too, and I need this group, when you sit down, keep yourself silent. Okay? May I? Now I'm going to show you the position of, may I? The position of the dentist to the patient. My position should be always, when I'm giving anesthesia, no, I said here, come here. Okay? My position should be always in front of the patient, exactly like this. Okay? Clear? If I'm working on upper teeth, guys, please. If I'm working on upper teeth, the patient should be within, parallel to my shoulder. Okay? Parallel to my shoulder. If I'm working on lower teeth, he should be in the level of my elbow. Okay? That's why, why we do it like this.
Too comfortable?
For you.
Yeah, to the dentist.
Okay? It's more healthy for you, for my back and for my shoulder. So my shoulder cannot be tired. Okay? Because in extraction sometimes we have strong teeth, especially the upper six. Okay? So we need much force. Okay, so when I put the patient with my shoulder, خلي هو المفروض الكرسي يصعد. Okay, بس ماكو تقسيم. Okay, with my shoulder, the movement like this is easier than like this. Okay?
For lower, you use your elbow for upper teeth?
No, not use. Just a measurement.
Just for measurement.
Okay? Can you give me a needle, please? Cartridge. Shinaka. No. Gloves, of course. Mirror. Okay. Now, cartridge. اوتا بدستي مرة. Now, I'm going to show you the parts. This is a non-aspirating metallic dental syringe. How do I know it's not aspirating?
No harpoon.
Because it doesn't contain a harpoon. Okay? It's flat. It's flat. Okay? Now, the part that it moves, this is called the piston. Okay? These are the finger grip. Okay? Here we're supposed to have the thumb ring, but this is non-aspirating, so I don't need to pull. Okay? This is the outside, this is the barrel, and this is the threaded end. Okay? This is the syringe. About the cartridge, cylindrical glass, okay? Plastic or rubber stopper, aluminium cap, and the diaphragm is inside. Okay, can you see it? This is the diaphragm. Okay? Can you see it? Okay? Now, to put the cartridge inside the syringe, simply just pull the piston, okay? And it will be opened. Okay? Just pull the piston, it will be opened. Okay? Insert this. The aluminum cap should be facing to the threaded end. Okay? Now I have the cartridge inside the syringe. About the needle, I check if it's long or short or medium. Okay, this is a long, okay, 27 gauge. We know what's the gauge, correct? Okay, so if I got a fine needle, يعني باریک, the gauge is, thank you. If I had a wide needle, the gauge is low. Okay? Clear? So I open my needle, and what I can see in front of me is the cartridge penetrating end, okay, and the plastic adapter, okay. So I insert it just like that, like screw, okay. When I open the needle, I will see in front of me the hub, okay, the shaft, and in the end we have the bevel. But this type doesn't contain the arrow that tells me where the bevel is.
The
Okay.
direction.
Yeah. Okay? Okay, I gave the injection. Please, 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 never put the cap back again like this. Okay? 1,000 times you may get it correct. 1,001 you will be mistaken. The patient had AIDS, you will have AIDS too. Khwanaka. Okay? So please, when you try to get it closed, put the cap right here and then simply just put the needle inside and then you cannot be mistaken. Okay? Guarantee your safety. Your safety first. Okay? Now, the first technique is the inferior alveolar nerve block. Okay? Did you see me touching the mirror? No. I don't want to be the hero of anesthesia. Okay? Now. لا تخاف ما راح أشيل الكاميرا. Okay? I said I have to be in front of the patient, right? What if I have the left side of the patient? How can I work on it? How can I work on it? I have three methods. I have three methods to work on the left side of the patient if I'm giving inferior alveolar nerve block. Okay, three methods. The first method is called cross hand technique. Cross hand, which means I put this index, open up please, on the notch and get the needle with the syringe with the right hand, okay, between the first and the second premolar, and I insert my needle inside the soft tissue. Okay, this is, I'm showing you this movement, not the place, not the landmark, not yet. Okay, I'm just showing you this movement. Okay, this is the first method. Okay, second method, I can get it with my left hand. Okay, simply the landmark, I find it with my right hand and I give, you have to learn for it. They taught us, yani in my university they taught us on both hands. Okay, it was written on the board, please give anesthesia to the left side of the patient with your left hand. If you gave with your right hand, you get 0. They taught us like this. I don't know here is the same or not. Okay, so I can give now in both my hands. Okay, so this is the first and the second method. The third method is I come behind the patient, I stand up, I come behind the patient, and I feel the notch with my thumb, not my index, with my thumb, exactly like this, okay? And I come between the first and the second premolar with my right hand and inject. Okay? So the first is cross hand. This is for the left side. Okay? If I'm right-handed person. Okay? The second is with my left hand. The third is behind of the patient, and this will be the guide for the notch. The thumb, not the index.
Can
Tamam?
you just first one? The first one, cross one.
The first one is your index, okay, on the notch, and you will get cross your hand, okay, and insert it in the side.
This is more comfortable.
No, this is not more comfortable. Wallah, the left hand or coming behind the patient is easier, okay, because you cannot insert all of your fingers inside the patient's mouth. It will be annoying for him. True?
يعني سيدي رجعت هنا أنا.
Okay? Clear? Now, I'm going to show you the first technique. Please put the camera very close so we can see
Like
the
this?
landmarks. You can see it, I don't see it. Okay? Now, first, to find the notch, please look at me. Look at me. Thank you. Thank you. To find the notch, I have my hand now on the external oblique ridge. Okay, you'll see the video. You'll see the video. Don't worry. I have my hand now on the external oblique ridge. I will get up to the ramus until I reach the coronoid. He can feel now I'm on the coronoid. Okay. As soon as I get down, I twist my finger. Now I am on his notch. Okay. Open. I am on his notch. Okay. This is the pterygomandibular raphe. Can you see it? You cannot see it in the camera. This is the pterygomandibular raphe. Open up, please. Open. Yes. This is the pterygomandibular raphe. Okay? From the opposite side, between the first and the second premolars, between the raphe and my index, I insert parallel to the occlusal plane in this site exactly. Okay? Clear? You will see it in the video. Clear? Okay?
اوكي.
Speak.
هذا اشعر بيها.
Okay? This is the first technique.
اوكي.
The second technique, the go gate. أنا ليش دا أضغط شوي حتى أنت هم تحس بيها حتى تعرفون.
اي تمام.
Okay?
صحيح.
لأن ما راح يعطوني volunteer ثاني. Okay?
اوكي.
This is the first technique. Now, the second technique is go gate. First of all, I see the line, the imaginary line, okay? From the corner of the mouth to the tragus of the ear. Okay? Clear? Open up, please. Maximum opening. Yes. Thank you. I can give you go gate right now. Okay? This is a maximum opening of the patient. Now, this is the distopalatal cusp of the upper second molar. Okay? There it is. He has an 8. I leave the 8. I imagine that there is no 8. Okay? I imagine that there is no 8. With the line, the imaginary line, behind the distopalatal cusp, I insert my injection until I reach the condyle. Now I am on the condyle. He can feel it. Okay? Okay, I'm on the condyle, exactly on the condyle. Aspirate, no blood, inject. Don't close your mouth immediately. Yes, thank you. You keep the patient opening his mouth for like a minute to a minute and a half, and then close slightly. Okay, that's it. This is the...
Back of the 8 you mean?
No, I imagine that there's no 8.
Okay يعني
Okay.
يصير below and زي كده بالضبط يعني.
This is the distopalatal cusp. Distopalatal cusp. Out behind it. With the imaginary line. Okay? I cannot repeat again because he's getting tired. Okay? You can see the video later. This is إيه طبعا بس this لشوي دايدني who دايدني no it's simply just like this no you can feel yes you can feel the coronoid here okay not the nose okay you can feel the coronoid here okay the neck of the condyle which is behind the coronoid okay clear. This is the second technique. The third technique, I'm allowed to use the mirror. Okay? I'm allowed to use the mirror because he will be smiling as much as he can. Okay?
Can you do without mirror also? Or you must?
No, it's easier for you.
يا ودي كافي.
Okay? Close your mouth and smile as much as you can. See? This is the gingival margin which I was talking about. Okay? Upper. This is the gingival margin. Okay? Parallel to it, طبعا the cap will not get inside because the needle is much finer. Okay? So I'm just going to show you the way.
دكتور نص دقيقة ولا طلعوا ذولا.
Okay? Yeah. Okay? Simply just beside the gingival, you go in, you don't go out. You see? You go in, not out. Okay? Inside, not outside. يعني medially, not laterally.
اوكي.
Okay? You can ask your assistant to pull the cheek and you should put your finger right here. Okay? Or the assistant can tell you, but it will be better in your fingers. And you can also do it like this, see? Like this, and you will feel. Okay? If your hand is big enough. Okay? Now, أكيد females cannot do this. You must have an assistant, but the assistant should be retracting the cheek only. You will feel. Okay? It's better. Parallel to the gingival margin. ما مشكلة كي لكيو نيا bone near. So you don't have a guide. So you just insert it parallel to the parallel to the
Gingiva.
gingival margin and
Here we don't have aspiration.
medially, not laterally. Yes, we have aspiration, of course, yes.
We have aspiration.
Yes.
soft tissue.
Yes. You might have a blood vessels. Okay? It's the same as the first technique. When you get out, you give the lingual.
No, but about aspiration in the vaginal nose, it's soft tissue. يعني. Inside of soft tissue.
You don't have blood vessels inside soft
We
tissue?
have, but يعني شو هذا الشيء خفيف.
No. No, no. No. Okay? If it was a large vein, then it will give it blood. It will give you blood.
Otherwise,
Yeah,
no.
you don't have that. Clear?
Clear.
So,